Conquering depression and anxiety. Effective strategies for lasting mental wellness.
Introduction: Understanding the battle within.
In today's fast-paced, high-pressure world, depression and anxiety have become common mental health challenges that silently affect millions. Despite their prevalence, they are still surrounded by stigma, misunderstanding, and misinformation. Many people feel isolated, ashamed, or uncertain about seeking help. Yet, these conditions are not signs of weakness. They are real, treatable mental health disorders. Conquering depression and anxiety is not about a quick fix. It's about a deep commitment to self-awareness, compassionate care, and long-term strategies that promote healing and resilience. In this video, we will provide you a comprehensive guide to understanding these conditions and employing scientifically supported methods to regain control and restore emotional balance. Depression, major depressive disorder, is more than just sadness. It is a prolonged state of low mood and disinterest in life that impacts thoughts, behaviors, emotions, and even physical health. Common symptoms include persistent sadness or low mood, fatigue even after rest, loss of interest in previously enjoyable activities, feelings of hopelessness or helplessness, difficulty concentrating, appetite or weight changes, sleep disturbances, thoughts of death or suicide. Anxiety is a natural emotional response to stress or danger, but when it becomes chronic, intense, and disproportionate to the situation, it can be classified as an anxiety disorder. Types include generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD. Common symptoms: constant worry or fear, racing thoughts, physical symptoms like increased heart rate, dizziness or nausea, avoidance of anxiety-provoking situations, sleep difficulties, feeling tense or on edge. Understanding the origins of depression and anxiety helps in tailoring treatment strategies. These conditions are multifactorial and may result from a combination of biological factors, imbalance of neurotransmitters, e.g. serotonin, dopamine, norepinephrine, genetic predisposition, hormonal changes, e.g. postpartum depression, psychological factors, negative thought patterns, low self-esteem, perfectionism, environmental and social factors, trauma or abuse, chronic stress, financial issues, job pressure, social isolation, unstable family environment, lifestyle factors, poor sleep hygiene, substance use, lack of physical activity, unhealthy diet. Cognitive behavioral therapy, CBT, is widely recognized as one of the most effective therapies for both depression and anxiety. It helps individuals identify distorted thought patterns and replace them with healthier ones. Other evidence-based therapies include dialectical behavior therapy, DBT, combines CBT with mindfulness, helpful in emotional regulation. Interpersonal therapy, IPT, focuses on improving relationships and social functioning. Exposure therapy, useful for phobias and PTSD by gradually facing fears. Antidepressants and anti-anxiety medications can correct chemical imbalances in the brain. SSRIs, e.g., fluoxetine, sertraline. First-line treatment for depression and anxiety. SNRIs, e.g., venlafaxine, work similarly but affect norepinephrine as well. Benzodiazepines, short-term use for acute anxiety or panic attacks, use with caution. Beta blockers, reduce physical symptoms like racing heart in anxiety. Important, always consult a licensed psychiatrist. Medications should be tailored, monitored, and adjusted over time. In severe cases involving suicidal ideation or psychosis, temporary inpatient care may be necessary to ensure safety and provide intensive treatment. Regular exercise. Physical activity improves mood by releasing endorphins and reducing stress hormones like cortisol. It also boosts energy and self-confidence. Effective practices: 30 to 45 minutes of aerobic exercise, 3 to 5 times a week. Yoga, Tai Chi or Pilates. Nature walks and hiking. Nutritious diet. What you eat affects your mood. Certain nutrients can improve brain function and reduce inflammation linked to depression. Mood-boosting nutrients: omega-3 fatty acids, salmon, walnuts. B vitamins, leafy greens, whole grains. Magnesium, dark chocolate, avocados. Probiotics, yogurt, kimchi. Avoid excessive caffeine, alcohol, processed foods and sugars. Adequate sleep. Sleep and mental health are deeply connected. Poor sleep can worsen symptoms and lead to emotional instability. Tips for better sleep: stick to a consistent schedule. Avoid screens an hour before bed. Create a calming pre-sleep routine. Limit naps and caffeine. Mindfulness and meditation. Mindfulness allows you to become aware of your thoughts without judgment. Meditation reduces rumination, lowers cortisol, and promotes relaxation. Suggested techniques: body scan meditation. Breathing techniques: box breathing, 4 to 7, 8 method. Guided meditations, apps, Calm, Insight Timer. Challenge negative thinking. Through CBT techniques or journaling, individuals can learn to identify irrational thoughts, replace them with realistic alternatives, reframe failures as learning opportunities. Develop emotional regulation skills. Emotion regulation helps manage intense feelings and reduce impulsive reactions. Try DBT's STOP skill. Stop, take a step back, observe, proceed mindfully. Self-soothing through music, warm baths, or aromatherapy. Expressing emotions through art or writing. Loneliness can significantly worsen mental health. Building and maintaining healthy relationships is essential. How to build support. Reconnect with trusted friends or family. Join local or online support groups. Volunteer or engage in community activities. Seek out a mental health mentor or coach. Sometimes just knowing someone listens can make a world of difference. Finding meaning and purpose can anchor your recovery. Ways to rediscover purpose. Engage in spiritual practices, prayer, meditation, reading sacred texts. Set small, meaningful goals. Focus on acts of kindness and service to others. Reflect on your values and personal strengths. Rediscovering passions can reignite hope and enthusiasm. Creative outlets include painting, drawing or sculpting, playing music or learning a new instrument, cooking, gardening or photography, DIY projects or interior decoration. These activities offer not only distraction but fulfillment. Recovery is not linear. Relapses can occur. Having a proactive plan is key. Essential components: emergency contact list, doctor, therapist, trusted friend, crisis plan for suicidal ideation or panic attacks, regular mental health checkups, a daily self-care checklist, boundaries to protect your energy and mental space. Conquering depression and anxiety is not about erasing pain. It's about learning to live meaningfully despite it. It's about transforming suffering into strength and rebuilding a relationship with yourself grounded in compassion, patience, and self-belief. Every small step matters, whether it's taking a walk, making that therapy appointment, or just getting out of bed. You are already moving forward. You are not broken. You are healing. The Happiness Trap, Russ Harris. Feeling Good, The New Mood Therapy, Dr. David D. Burns. First, we make the beast beautiful. Sarah Wilson. Lost Connections, Johann Hari. Mind over Mood, Dennis Greenberger, Christine A. Podesky.